So yes, my name is Michael Frommer. I am the policy analyst at the Australian Federation of AIDS Organisations. I'm actually presenting today work done primarily by AFAO, led by Jill Sargent, our project officer, who's led the work on African communities and HIV since 2009, but she's unable to be here today, so I'm very honoured to be able to present a lot of that work. I'd also just like to acknowledge the Indigenous custodians of the land and pay my respects to their elders past and present. AFAO, for some of you who may not know, is the Australian Federation of AIDS Organisations, and our membership consists of the state and territory AIDS councils and the peak bodies for key affected populations, sex workers, people living with HIV, injecting drug users, and Aboriginal communities represented by the ANA. So that's the beginning. So AFAO's African Project began in 2009 in response to an increase in Australia's HIV notifications among people born in Africa and reports from service providers about the particular challenges faced by African Australians living with HIV, such as migration issues, which I'm sure we all know about, and stigma. Program activities since 2009 have included discussion and briefing papers, a literature review, a mapping of HIV health promotion activities, which is subject of part of this presentation, and 3 national forums, including one specifically for African faith leaders. And we actually have some materials out the front that arose from the faith leader work, sort of a stigma faith leader, I guess, starting the conversation. So feel free to help yourself to that. The project will continue in 2016 and 17 with AFAO supporting the African Reference Group to become an established independent national network. So the called work builds specifically on the previous work done amongst African communities and leaders. And while a lot of our policy work, such as migration, has been relevant to called people more broadly, this project among called populations began formally last year. So this presentation will report on 2 key components of that project. The 2015 mapping, which this is the sort of visuals. We don't have any more hard copies of it, but it's available for download. I'll be going into it in more detail, but you can take these flyers. I'll put them out the front afterwards. And also the HIV and Mobility Forum that was held on the 30th of May, so just a few weeks ago. Okay, let's see if I can. Oh, excellent. Okay. So in 2015, AFAO developed a resource for health promotion workers, HIV and called communities mapping health promotion programs and resources, which lists over 70 health promotion programs and resources that have been developed to engage with called communities around HIV prevention, awareness and support. The resource is an update and an expansion on AFAO's 2013 mapping of HIV health promotion within African communities. So the African mapping was evaluated before we started work on the called mapping and resulted in a few changes to how we organised and presented the information, as well as giving us some more ideas about how the mapping had been used and sort of feeding that into the updated broader one. So Alison Coelho from the Centre for Culture, Ethnicity and Health, who was a board member of AFAO at the time, launched the mapping at an African community meeting around the ASHAM conference in Brisbane in 2015, and I'm now going to just show you a few slides about the mapping itself. So this is the table of contents. I'm not expecting you to be able to read each title, but it is possible, I think, to see that it's organised by state and territory, and within that by kind of key important groups. So sometimes it's the affected population, so sex workers or women or men. Sometimes it's more about a community level thing. So whether it's, I just saw faith leaders or, or community generally, whole community. And online, the PDF contents are hyperlinked, so that can be quite handy. Oop. Okay. So this montage gives you an idea of the huge range of initiatives that are showcased in the resource, which include music, video and drama activities, translated resources, community forums, World AIDS Day events, soccer tournaments, cultural competency training, print resources, social support groups, outreach, peer education, advocacy and internships. So I guess it just gives you a sense of the richness of what does already exist. And I think sometimes we can be caught up just in what's immediate and local and just not really have the opportunity to know what's going on elsewhere. So one size certainly doesn't fit all, especially in relation to genuine community engagement and leadership around health promotion, but by showcasing the rationales and evaluation information about other programs, this resource can help you to think about how you might approach your own work. So you can also ring the key contacts to chat about their listings if you want to find out more. And programs that may evaluate it well may help you in terms of providing supporting evidence for your own funding proposals or advocacy initiatives. And alternatively, those that may not have gone as well might be some lessons that you can integrate if it's applicable to the sort of thing you may be contemplating. You can also see what kind of organisations and agencies other programs have partnered with. So that's listed there. I'm not sure, but anyway, you may not be able to see it. It says partners down. Oops, where are we? Down there, listing of partners. So it could help you think outside the square in terms of people you may want to collaborate or just get support from. And as I said, the PDF hyperlink to resources means that they're easily accessible for some online, or if not, you can obviously contact the agencies and seek hard copies. Another interesting aspect is the use of it potentially to induct new staff. So we found that was some feedback we had after the 2013 mapping, that several organisations who've been in receipt of it found that it was a useful thing and something that you could use for orientation for the sector. And this is a slide obviously for Tasmania, beautiful I think Cradle Mountain potentially. And as you can see, perhaps in a jurisdiction which is much smaller that may not, again there may have been activities we didn't include, but for what we could find there weren't specific programs at that time that were listed, but we still provided references for important, I guess, state-based services. So there's something there, even if it's not as detailed as potentially in other jurisdictions. Okay, so this is no longer the mapping. So in May 2016, AFAO hosted a national forum on HIV health promotion for called communities, bringing together over 60 stakeholders from HIV and multicultural health organisations across Australia. The forum aimed to build capacity for organisations to develop future health promotion programs and resources through providing current information and identifying key principles for best practice. You see that at the end, so everyone's quite happy because it's been a long day, but fruitful. The forum goals and programs were developed by AFAO in consultation with a reference group representing our membership and partnership with the multicultural sexual health and bloodborne virus sector. So in order to meet our first goal, we invited speakers to present on HIV notifications among called populations. I think Pravina is here, she'll be presenting later, so thank you. COPAM and the HIV and Mobility Roadmap, cultural appropriate health promotion, and the impact of Medicare ineligibility on called populations. So AFAO's African and called project officer, that's Jill, gave a presentation on the mapping and outlined some of the key challenges.